Hello and welcome to another informative series on SYNLAB Podcast. My name is Patsy Mokungah and I'll be your host. In this series, we're going to be talking about something that I believe is quite relatable to most people because the chances are you know somebody who needs this information. In this series, our topic is going to be living well with arthritis. Right now, I'm going to stop and remind you to like this podcast, comment on this podcast, subscribe to this podcast, and share it with everybody that you think will need this information, both on YouTube and Spotify. You can also follow SYNLAB on all social media handles. I personally, for one, I'm not an authority or an expert on today's topic, arthritis. So I have with me here somebody who is impressively qualified to do so, if I do say so myself, and will be helping us with a lot of information on arthritis. I'd like you to meet Dr. Charles Ifudu. Now, before we delve into the topic, I want to tell you a lot more about him. So, Dr. Charles Ifudu is a rheumatologist in the Department of Internal Medicine in the Enugu State University Teaching Hospital in Park Lane in Enugu. He graduated from the University of Port Harcourt Medical School, and he is a member of the West African College of Physicians and a member of the Nigerian Society of Rheumatology. He's had his rheumatology training at the Lagos State University Teaching Hospital, Ikeja, under Professor O.O. Adelowo, who himself is a consultant rheumatologist and the first West African professor of rheumatology. So we can see that we're about to hear from very qualified hands. And I'm excited to delve into this topic. Hello, Dr. Ifudu. And we're very pleased to have you here with us today at SYNLAB Podcast. How are you doing today, sir?
I'm doing very fine. Thank you for that introduction. Thank you.
Okay, you're welcome. So, diving straight into our topic for today, I'd like you to help me and our audience to understand what exactly is arthritis and how does it impact daily life. I'm sure most people have heard about it. We hear about it a lot. Somebody in your family, somebody you know somewhere has arthritis, but what exactly is it?
Arthritis can be defined as inflammation of the joints. So I would like to define inflammation. So inflammation is a cascade of events. We define it as a cascade of events that occurs during the normal response of the body to infection, injury, or toxic chemicals. Then joints, on the other hand, could be defined as a region where two bones make contact. So we're having entities, inflammation, and the joints. So when this occurs, it brings about pain, brings about swelling, also brings about redness and loss of function of the joints. So arthritis is simply the inflammation of the joints. So that's why for understanding, that's why I defined what's inflammation and also the joint is, so that our audience will also understand it.
Okay. Thank you very much, sir. I think this has helped me because prior to now, if you say inflammation, the only thing that my mind thinks of is swelling. But per your definition, it seems like inflammation is a bit broader than just, normal swelling. Because in my head, if it's inflammation, anything that swells is inflammation. Okay, but I believe that I have heard that there are different types of arthritis. So can you help us understand what the different kinds of arthritis are and how do they affect the body?
All right. Moving forward, you also asked about how does it actually impact on daily life.
Okay, yes.
I thought I heard that.
Yes.
Yes. So, well, the arthritis actually has significant impact on our daily life. So, first of all, we'll talk about the physical limitation.
Mm-hmm.
So, physical limitation, because we know that pain, swelling, and even stiffness from this arthritis can affect the activities of daily living, like walking, climbing stairs, and also dressing. So that's the physical impact on that. Secondly, it can also affect work and other work-related activities.
Okay.
Like during patients with arthritis, they find it difficult. Sometimes it can be late to work. They can even be absent from work. They can even try to change jobs, and it can even lead to early retirements. Then other things like social activities and leisure time. It actually affects the social activities. I can imagine somebody dressing up to go for a wedding or a naming ceremony,
And then they
and all of a
can.
sudden starts feeling pains of arthritis. So it can actually disrupt the person's movements. Another one is the mental health. So the mental health, arthritis can actually affect the mental health, can cause anxiety, can cause depression. It can also reduce the quality of life of people. It can also affect even relationships. It can alter roles. It can alter responsibilities. Then even in age, although the arthritis can affect middle age and the elderly, in the sense that you have a cumulative effect of the joint damage and other age-related health issues. So that's how arthritis can impact on actually impact on our daily life. Thank you.
Okay. So what are the kinds of arthritis, like different types of arthritis, and, how do these different types of arthritis affect the body?
Okay, so we have, over 100, more than 100 types of arthritis have been described, but
Okay.
we
Wow.
have the common ones.
I wasn't
So, and we
expecting
group
that.
them into the
Okay.
non-inflammatory arthritis and the inflammatory arthritis. So the non-inflammatory arthritis, which will also called the degenerative arthritis, of which osteoarthritis is part of it. Non-inflammatory in the sense that
Okay.
inflammatory mediators are not actually being released. So, and the characteristics of this non-inflammatory arthritis, of which osteoarthritis is part of it, is that usually the pain usually gets worse with activity or with movement. Another thing there is this arthritis usually gets reduced. The pain usually reduces when the patient is at rest. So that's one of it. So, and I
Okay.
mentioned osteoarthritis as one of them. Then we also have the
Yes.
inflammatory arthritis, which usually occurs when the inflammatory mediators are released. So, and one example of this arthritis is arthritis caused by or some autoimmune diseases like systemic lupus erythematosus, Sjogren's syndrome. Then we
Okay.
also have scleroderma. You also have other ones like the spondyloarthropathies, the psoriatic arthritis, and even rheumatoid arthritis. Then we also, this inflammation can also be caused by deposition of some crystals in the joints, where we have what we call crystal arthropathies, like the ones we have in gout, the pseudo gouts. Then also inflammation caused by infections like in septic arthritis. Then also Lyme's arthritis. So these are the different kinds of arthritis we have. Thank you.
Okay, so what's the major difference between this inflammatory and non-inflammatory arthritis, especially given that in the definition of arthritis you gave, like arthritis is when the joints are inflamed, right?
Yeah.
But then there's now arthritis that is non-inflammatory. Can you just help shed more light on this, like the differences?
Okay, so the thing is that in a non-inflammatory arthritis, basically we call degenerative arthritis because sometimes, especially in the middle age and the elderly, when you usually have the degeneration of the structures around the joints. So non-inflammatory in the sense that it's mechanical. The inflammatory actually being released. They usually progress. You also have some forms of inflammation going on. But basically, majorly, the non-inflammatory or the degenerative forms of arthritis, they usually don't, the inflammatory mediators are not being released as in the case of inflammatory arthritis. So, and the difference is that first, I even described that the non-inflammatory arthritis, usually the pain usually gets worse during movement or activities, and they usually relieved at rest, which is the opposite of the inflammatory arthritis, which is usually gets worse at rest. And when the patient moves or during activities, the patient usually gets some relief. So those are the differences. Thank you.
Okay. So, what would you say are the biggest myths about arthritis, like things that are said that are not true but are widely believed about arthritis?
Okay. Yes, we have several of them. Some people believe that
Okay.
bathing every day with cold water can cause it. Then being in an
Oh,
air-conditioned rooms during cold weather, those are the myths some people we usually get. But the thing is that well, I also have some patients complain during the cold, they have this, they feel that they're having
joint
their
pain.
symptoms. Well, the symptoms can aggravate during the cold because you can have a synovial membrane disruption, and the pain receptors around the area can be stimulated. So that's why it looks as if it causes that it doesn't cause arthritis, but that's actually what happens around it. Then other myths are like uh, the arthritis occurs in the old age, only in the old age, and even the females only occurs only in the females.
Oh, wow.
So we know that arthritis can even occur in the young, um, and also in the old. Then also the that of the females, not only the females, it can occur in males. In fact, there is even a special arthritis which is called gouty arthritis that is commoner in males than females. So because especially in the females in the young age, because they tend to say that the estrogen is protective up to the point,
Okay.
up to menopause, when the at least the estrogen level has reduced. So that's it. So those are the myths. Even some arthritis caused by autoimmune diseases like SLE, rheumatoid arthritis, they tend to attribute it to spiritual attack. Those are the things
Makes
people
sense.
uh, believe, and even injections in the joints, they even believe that it can damage the joints. So those are the things that means that needs to be debunked by patients and other people that also have these perceptions or misconceptions. Thank you.
Okay, thank you very much. Like you said, the reason why we're here is to debunk things like this that I never even thought about the fact that it's possible for somebody to think that arthritis is more prevalent in women than men. It's almost giving men don't have bones or men don't have joints. I don't know. But anyways, thank you very much. So far, we've been able to understand what arthritis is and to know that it is inflammation of the joint. So it affects mainly just the joints in human beings. We've been able to see how it impacts daily life, which by your explanation goes into almost every aspect of your life. So if you have arthritis, it can affect you physically, it will affect you mentally, probably even emotionally, affect your daily life. And we've come to learn, and I'm sure our audience too has come to learn, that there are two different kinds of major groups of arthritis, which is the inflammatory and the non-inflammatory arthritis, and even how these two play out. So I know so far so good. We've been able to cover a lot and learn a lot. And I want to thank our audience for being here and tell you to sit very tight because we'll be back with more information about arthritis. And while we go on this very short break, I want you to like this podcast, subscribe to this podcast, comment about arthritis and what you've learned so far, and more importantly, share it to everybody who you know that this would be relevant to. Thank you very much, and I'll see you very shortly in our next episode.